Verde, J.D. Hayworth welcoming you back to America's Forum. We continue our conversation about Ebola now with Dr. Elaina George, who joins us by phone from Atlanta.
And doctor, I wanted to follow up on something you spoke about just a couple of minutes ago, if we could. You talked about a patient being asymptomatic, which obviously means not showing any symptoms. So if I am a passenger on that plane, should I be concerned, or I am in the clear, no problems? Your opinion, doctor?
I think if the person wasn't showing symptoms, wasn't sweating, sneezing, coughing, certainly if that person did not come into contact with body fluids, I think it's a very low likelihood that they were infected. I'm more concerned with the people in that 4-day period when he presented to the hospital, to the emergency room, went back home to his family, and then came back.
Doctor, as you were mentioning these things, we are taking a look at footage from airliners in Africa. And there's so much we're trying to process with this news coming in now. And maybe we need to back up a little bit in terms of public health lexicon. We hear talk about epidemic, pandemic, etc. What is the difference between an epidemic and a pandemic?
A pandemic means that it's moved worldwide. I mean, we're talking about moving outside of a contained area. Epidemic usually implies that it's in the city or in the site, that they're infecting more than one person, a group of people. So pandemic obviously is much more concerning because that involves or affects everybody in the world potentially.
So at this point, what would Ebola be considered to you?
It's an epidemic at this point. It's still trapped for the most part in West Africa. My concern is the frequent air travel, which was one of my main concerns initially, is now coming home to roost, with people getting on a plane not knowing that they're ill and traveling to parts unknown where they can potentially get sick where they land.
Well, Elaina, you mentioned parts unknown. We do know that American carriers are servicing West Africa. Do you believe, for public health, that our public transportation, our international air travel transportation involving United States Airlines, should that be halted forthwith?
If I had control of the situation, which I don't, I think it's prudent to stop travel to these places. As a matter of fact, Sierra Leone has actually stopped travel out from their country. So the countries that are affected are actually doing this as well. It makes sense that we at least, if not that, then quarantine people for at least 3 weeks before they're allowed to travel. That would make at least some sense.
And anybody arriving, let's say, from this area into the United States, we should do what?
We should have them quarantined in their home country for at least 3 weeks. This gentleman didn't show any signs. If they did a temperature check, he wouldn't have shown that he had a fever, yet he manifested his disease here. If he had been in quarantine for a certain period of time, he actually would have shown that he was affected before he left his country. And that's reasonable. Then you don't have to stop airline travel. It makes somebody at least go through a long enough quarantine that you're sure that they're not, unbeknownst to them, carrying the disease outside their country.
Elaina, about a minute left. From a medical perspective, we heard the director of the CDC talk about concentric circles. Given the way this guy presented, do you expect public health officials to descend on some neighborhood in Dallas and start quarantining members of this guy's family and those in the neighborhood?
The way Dr. Frieden described it, they're not going to quarantine people. They're going to question people and follow up with them closely. That means have them come in, or maybe a CDC will send people out to check on their health status. I think it might be wise to actually quarantine them, because it's people who don't show symptoms right away that you really are concerned about, because you don't know.
And an ounce of prevention worth a pound of cure. I believe that's the way Dr. Benjamin Franklin put things way back in the day. Dr. Elaina George, a very serious topic that you approach very sober-mindedly. We appreciate your perspective in terms of healthcare and public health. Thank you very much.
It's a pleasure to be with you.
Dr. Elaina George, our guest, will be back with more here on America's Forum following this time out.